that I've been working in. Yes, and so as you see today, we do have the ASL interpreters, and they'll be working on the behind the scenes to see if we are able to enable captioning as well. But yes, we'll be talking today about the unique and kind of beautiful role that comes with being survivor advocates. This is a really important topic that I just think we don't ever, very rarely in spaces are we able to directly address it. And so Becky, if you could do the next slide once you hit that. Thank you. And so today we're going to spend a little bit of time kind of just laying the groundwork and the framing for what we're talking about, because it's not just one simple kind of nuance to this. And then I'd love to talk about some ideas that, as a team, we were able to kind of come up with for individuals to be able to, take care of themselves within the workplace, as well as ideas for programs to be able to really create environments that are welcoming to survivors, as well as conducive to having survivors thrive within spaces. All right, next slide, please. All right. So when we're talking about survivor advocates, we are talking about those who are within our movement who have experienced sexual violence within their lifetime. I feel that it's this idea of, we are who we serve. I feel that I got a little bit disjointed from kind of the start of this call, and I want to just take a step back and take a deep breath for myself, as well as just do a better welcoming of myself, an introduction. My name is Jolene Engelking, and as I said, I am the coordinator of our MIWSAC's National Tribal Sexual Assault Resource Center, which is really focused on developing resources, and that's including things like these webinars, things like handouts, templates, samples, whatever folks may need. I am White Earth Anishinaabe from here in Minnesota. I am a mother, I am a daughter, I'm a sister, I'm a runner, I'm a theater lover. I am the many things that make me who I am. And I think that that is something that is essential and key, is thinking that that we can't separate ourselves from the different parts of our identities. And so for me, being a mother, and those things that I've experienced within my life are just as important as the degrees that I have, or all these other sorts of things that may be, more visible. And so when we're talking about folks who are survivor advocates, I feel that both parts are, we can go to the next slide, equally important to folks. And within our movement, all of our programs, particularly our tribal programs, both the coalitions and the programs on the ground, were really created by and for survivors. It was our aunties and our grandmothers who did so much work to build programs, to garner funding, and to do all the things that make what we're doing today even possible. And so one of the things that I feel is essential for our movement is that it is driven by survivors, by those who are most impacted, those who have experienced sexual violence themselves and experienced violence within our own families. And I think that we need, and that is not saying that folks who have not experienced sexual violence do not have a place within, the movement, but we do want to center those who are most impacted within the work. And so with that means that we are bringing all of ourselves, right? We can't necessarily, people talk about wearing different hats, right? So some days you're wearing the hat of the administrator, some days you're wearing the hat of the advocate, some day you're wearing a hat as a social worker, or whatever it may be. And while I feel that can be true at some points, I also think that the more that we try to split ourselves, the harder it gets to be to do our work. And I think that to minimize survivorship, comes at the detriment to those who we are serving. And that is not saying that folks are needing to disclose all the time about their own life experiences, or even let folks know all the different parts of their identities. But within ourselves, we can't uncouple the different parts of ourselves. We can't fragment ourselves. And so I think that that's one of the things that we really need to be focusing on is within our workplaces. I think that it can get really hard because we are expected to code switch, or we're expected to be a certain way, or we're expected to be professional for whatever that means. And even within our tribal programs, I feel that sometimes we aren't always, it's not always welcome for us to bring our full selves into spaces. And that I think is one of those things, like in talking to advocates and folks all across the country, is where things can get really rough sometimes, is when you're constantly trying to think about who's my audience, who am I with, what am I saying? You're focusing so much more on how you're the performative parts of work and not really always being able to be genuine. And that's not an issue for everyone, but just wanting to kind of put that out there. One of the other things I kind of wanted to kind of talk about as a bit of this like background and framing is that our workplaces, particularly those of us who are doing, advocacy or working within advocacy programs, be it you doing finance, you answering phones, whatever it may be, or the folks of us who are at coalitions or TA providers, or even if you work in a school, whatever your context is for where you're working with survivor, these workplaces can be healing, right? So many folks, this is why people get into this work, is because something happened to you, something happened to your friends, something happened within your family, and you're seeing kind of the endemic nature of sexual violence. And we realize that we need to enact change. We need to be doing more. And so in those ways, it can be healing. So people find healing through helping others and through changing systems, changing community norms, bringing prevention efforts into their community. That work can be healing. It can be cathartic as a way to really just find your space, right? To take the pain that we've experienced and turn it into something that is really movement building and has those ripple effects. But also our workplaces can bring difficulty. There are triggers that abound when you're working either with survivors or with systems that can be frustrations in themselves, or with interpersonal conflicts within the workplace, or even just the ability to take the time that you need to care for yourself across wherever, regardless of if the sexual violence that happened to you happened, 30 years ago, or if it happened, 3 days ago. How are our workplaces really set up to be helping us as we explore, as we learn, as we grow, and also making sure that we have that ability to take care of ourselves and to be able to kind of say no and have good, honest communication about things. And so that's just kind of some of the background, is this idea that, the workplaces, working within advocacy, working within this movement is an amazing healing moment for a lot of folks. But it also can really cause a lot of secondary trauma and a lot of just like harm, or just like those sleepless nights that I think many of us have had, right? And also, so just really want to think both about the, because we all know, most of us have had, so many trainings on, how trauma appears within life and things like that. But really thinking both about how that impacts, the individual and also the collective community around you. And that's both your coworkers and the survivors that you serve and the work that we're doing. And so we're really just kind of wanting to have that balance, because there's some folks who seemingly their own trauma and their issues don't really kind of seep out within the workplace, and others where it's very palpable. And so we're kind of holding a lot of different truths right now. So next slide, please. All right, and here are just a few of the ways that kind of I've seen the violence that happens from, childhood trauma or life trauma across the lifespan. And this is both including, the sexual violence, child sexual abuse, domestic violence, all of that spectrum. it kind of comes out within our work environments. And one of the simplest ways is simply survivors not entering the movement. I think that so often people feel that they haven't had the training, that they're not, a clinical social worker, or they don't have a degree, or they don't have all these sorts of things. And I think that some of that can be linked to trauma, of the feeling less than, or that you're not good enough within spaces. And I think that the more that we can do as organizations and as communities to really create inviting environments, for survivors to be within our work, to be our coworkers, to be those people who we turn to for all the different things, who we work alongside. I think that's going to be all the better. And so trauma can also appear with high turnover. I think that I don't have stats on this, and I wish I did. And if anybody does have any kind of solid research they've seen on this, but this is just anecdotally, that I feel that the combination of low pay for many of our advocates, as well as workplaces that don't support folks, especially those who've been traumatized and who had traumatic events in their life, lead to that high turnover. So there is this cycle of advocates coming in and out of programs, which does a disservice to the partners that we work with, because it's hard to bring trust. I was working in one place I worked with, we were finding that the leader of the sexual assault response team was turning over about every 18 months, and often even shorter than that. And so people would just begin to kind of get to know somebody, and then they would leave. And so that's with our partners, who we really do need to be able to trust that, they can kind of turn to us for whatever may happen, but also within our community. If you're having people who just come and go so quickly, it's hard to feel that somebody actually knows what they're doing, that they are skilled at their job. If you're constantly having folks who've just been trained in, as well as just trusting that there is that level of confidentiality and all those other things that survivors really need to feel to have us, we have to show up. We have to prove that we operate with integrity. And so high turnover, I think, is a sign of programs who aren't able to really support folks who have experienced trauma in their life. In addition, once again, to the low pay that so many of our programs still have out there, as well as this feeling that advocacy is often a stepping stone career for many people. That's a tangent that I just went on, but I do think that high turnover is one of the biggest issues within our field. And then we also have folks who have been doing advocacy for 30, 40 years, and they may be even like the sole person within their program. And so there are no absolutes within things. I think that trauma, like I'll just name it, like within my own life, when things get stressful, I feel a lot sicker. I miss a lot more work. It is a lot harder to get things done. And I think that within our programs, especially because so many of our programs are understaffed. So when one person is, having to constantly call in sick, or they're feeling that feeling of dread as you're driving into work, it can really impact everybody. This isn't maybe as serious, but I think one of the biggest things that I've seen is when trauma really starts to come out, when you're starting to kind of really kind of have those struggles, or when you can kind of just feel it like emanating out of you, there's often limited creativity. You kind of get into like doing the motions of your job, of those kind of like you kind of just stick to the script. You stick to what's been done. The status quo is where we're at. And instead of having that creativity, that I think that is one of the most beautiful things that happens within advocacy, is both that mixture of resiliency and creativity, because often we have been under-resourced, under-respected. And so we've had to come up with these different ways of engaging community, engaging partners, engaging survivors, and just different ways of framing a very serious topic in a way that's palatable to other folks. And so when our creativity is limited, it really impacts our ability to do our job and to thrive and to feel good with the environment. And also, you're kind of putting out the same old stuff that's been put out, which doesn't lead to social or systems change as well. Trauma within the workplace can really also come out with those interpersonal conflicts. You start to have a coworker who you start to have a little rub with, or things will kind of peak. You're also having issues. I've seen people where with trauma in particular, with our partners, especially if they are, not that we all partner with law enforcement, but I've seen people who, if similar things are happening to what happened when, you know, they were sexually assaulted, or if something happened recently with one of their kids or one of their family members, it's hard to be working with the people who you feel either inadequately investigated your case or caused harm in another way. And that is, to call that an interpersonal conflict is not, I do not mean to minimize that in any way, but it can really create issues within the work in order for us to kind of do the best we can for each survivor. Because in those moments, even for the best of advocates, even the most seasoned advocates, it can be hard when things really correlate or correspond to the trauma that we've experienced ourselves. And so I think that that can just create these negative environments in a workplace. And it can be really hard for supervisors, for directors, for all these sorts of folks to be able to figure out, like, what is the best way to handle this? Because we want to be attuned to the individual's needs. Yet at the same point, unfettered trauma can be really hard for people to be working with. So, I mean, I've worked in places where one person's trauma would just seep out, and it ended up having most of the other people on staff leave because they weren't being taken care of. And so it's like, okay, if things are never going to change, people leave. And I think that because of a lot of these things, we have lost a lot of great people within our movement. But yeah, so also always just remember, this is always unique to a person. And people may have been doing advocacy and never had this really become an issue for years and years and years. And then all of a sudden, it can just happen where something just like hits the scent, the reminder, the whatever it may be. If there's just a time in life where all of a sudden everything seems to be going wrong. You know, if your car is broken down, if you know, you have all these medical bills coming up, and then there's also like work stress. It can kind of sometimes be that perfect storm to cause issues kind of to bubble up. And so these are just some of the ways that trauma looks. And I would love if folks are able to, you know, chat in or say other ways that they have really seen. I don't want to say the negative side of survivor advocacy, but those things that we've really seen create kind of issues within our work. And I truly feel that, once again, I am not trying to say that that survivors who are advocates need to be coddled, or that they are, like, you know, an issue within the workplace. It's truly just saying that we need to name the fact that we bring our full selves into space, and sometimes that causes issues. And so when we're thinking about, you know, like, we talk to folks in our community about being trauma informed, right? And so one of the things that kind of keeps bubbling up for me is, how are our workplaces trauma informed, like in a truly genuine way, and not simply in the way of, we have the nice colors, which I've seen some people be like, oh, well, we got a new room and we painted it like this light, soothing green, and so that means we're trauma informed. No, we all know that trauma informed means so much more than that. And also, like, within our tribal and indigenous communities, how are we really taking all of the context of historical trauma as well into account, right? And so if we're having a room, like, if everyone on staff is dealing with their own things, and some of it very far away, some of it can be incredibly recent. And I think that a lot of us, you know or have had experience ourselves, like, we're in advocacy and something's happening to us right now. Then we're in a violent relationship, or we were sexually assaulted, or it happened to our kids, happened to our nieces, nephews, whatever it may be, or someone in our family went missing, and you just never know when it will bubble up. And so how are we really using our, our indigenous values and teachings including access to ceremony, to be able to help us as individuals, but really collectively create environments, both in the work environment and within our communities, to just be better and to be healthier, is really kind of what I'm wanting to explore a little bit. So please chat things in. Next slide, please. All right, so we're gonna kind of start with that idea of taking care of self. And I know that there's some people who will bristle at the term self-care, right? Because it seems selfish. It seems not within our, Indigenous ways to only be thinking about ourselves, right? But I keep having to be thinking about how, if we can taking care of the self is really taking care of the community, and how it's not selfish to be able to name what we're needing to be able to best do our work and to be in space with others. So next slide. And so I kind of just was thinking about different ways of, breaking this down. And one of the things I really wanted to talk about, which that's a really weird phrase, the duality of boundaries. And really what I mean by that is I think boundaries are both incredibly good and incredibly hard within our work. I think that so often, I was trained in a clinical social work program, and boundaries were something that were pushed over and over and over again. And a lot of it seemed so foreign to me, because I'm in a program that was probably, like 90% white. And it just felt that the boundaries that were put in place were to kind of keep us away from the very community that we're wanting to do work with. And while I could understand and still understand why boundaries are important, I feel that especially within our small tribal communities, and especially within the very small tribal communities that some folks are coming from, it's hard to have these boundaries, and they may not look the same way that we've been trained. Or even if you're going to a lot of 40-hour advocacy trainings or things like that, you'll be taught different things about self-disclosure. Is one of those big things where I think boundaries kind of can come into play. And I know people have a lot of conflicting views on this. Some people are like, I am my full self, and I'm going to name my survivorship within spaces, and that's okay. Other people are like, I've worked with people who I didn't know, I've worked with people, I've known people for decades and never actually known that they were a survivor. Because even though they're in this work, it's not how they present. It's not what they come forward with. And other people are kind of in that middle ground of, yes, I'll disclose if it's appropriate, or depending on what the intent is in that moment, will it benefit the survivor? And so I think that there's a full spectrum of those. But also we've seen spaces where people are almost expected to name their survivorship, or else they're not taken seriously. This happened recently to some of my colleagues, where they're in a meeting, and obviously we were wanting to center survivor voices within things, but all of a sudden it came out that basically people weren't believing anything the coalition was saying because they weren't survivors themselves. And so there's this feeling where it's like, oh, so do we have to tell our own stories in order to do we have to be raw to these people who you might not have trust in, who may be having animosity towards you, in order to be listened to or to be trusted? And that's just something I find that kind of is really interesting sometimes. There's also, sometimes a lot of judgment that can come, especially if, as we're talking about how some of our, a lot of our traumas can be in the past, right? In childhood, adolescence, early adulthood, but some of it's happening right now as we speak. Or there's judgment that comes where it's like, oh, so you're an advocate, but I just responded to a domestic violence call at your house. How am I supposed to trust that you're able to do this work if you can't even keep your own house in line, right? And that can be really hard. And because I think there's sometimes also people feel that advocates are meant to be perfect, which we're not. We're still just trying all of our best to live our lives, right? And to do better each and every day. But we can't. And that's the thing. We can't always protect our family. We can't always protect ourselves. And so I've also known of advocates who, something happened, their child was sexually assaulted, and they didn't come forward because they didn't want the people, the other advocates, the law enforcement, the prosecution, to know what happened to them, and to potentially feel judged, or else have it impact their work or whatever it may be. And I think that that's one of the other ways that boundaries can be kind of hard. I also think that boundaries can be important. And I think that, especially within some of our communities, we're meant to give all. I was raised by so many advocates who were telling me that, like, they love to share what they call their war stories, about, working 90 hours a week and giving, hundreds and $100s out of their paycheck, to pay for this or that, for survivors or for their work. And how they would, be at family events and they would just leave, even though they weren't the one on call, and these sorts of things. And I think that because of the fact that we work in such crisis and things are, I've had people say, this isn't life and death, but for some people it is. And how are we best able to kind of have those boundaries of recognizing that, like, some people, that's the way they're built. That's the way that maybe even their trauma is coming out, is that they feel they need to dedicate their lives to that change. But also I've seen so many advocates who've done that for years and years and years, and they start to get a little salty and a little bit burnt, and a little bit harder to have them have like empathy or growth or curiosity within spaces. And so how are we, with this like new generation of advocates that are coming up, are we best able to really support them and being in taking care of themselves while they are doing the good and important work in their communities? And so if folks have boundaries, if it's I don't answer calls past 6 p.m. Or whatever it may be, I think we have to respect that. It's even hard, like right now for me, to be able to like take vacations. I was so set on my last vacation that I was not going to do any work. And sure enough, I did minimal work, but it was so hard for me to just not even check my email. And I think that trying to have these boundaries and be in workplaces where that's supported is incredibly important as well, while still not entering into, while still maintaining what's true to us and true to our values. And I think that also goes in line with the second one, which is that advocating for self. I think that it can be really hard to admit when we're struggling. There's some places, so like my work right now does a daily check-in, and it's less about work and more about how are we doing on a human level, especially post-pandemic, especially as some people are still working virtual, some folks in the office, and you can feel disconnected and disengaged. And so we have these check-ins every day, and sometimes people share a lot, sometimes people share very little. But there's so many work environments where you're expected to share either everything, and you have this level of enmeshment that can come, that can be unhealthy. And if you aren't feeling comfortable with that, you may be looked down upon, or you may not, or you may be seen as not, like the right fit for that culture or whatever it may be. Or if you feel that you do need to share, other places are like, no, we don't talk about that here. And so how do we really create environments where people are able to get what they need? And so I think that having folks who have just those ongoing conversations, to make sure that you're able to advocate for yourself, so that when you are having a hard time, that you do feel like comfortable being, even if it's in the midst of you having, like a big event coming up, how are you still able to be taking care of yourself? Because I think we've all seen people who just start to fray at the edges, because they have trauma response happening, as well as the work stress, and both are just being poorly taken care of at that point. And so I think that that's one of the biggest things, is figuring out those ways within your space, within your organization, within yourself, to be able to ask for the help that you need. Or sometimes I've even had to be like, I don't know what help I need, but I know I need something. And that can be incredibly vulnerable, especially depending on, where you're at within your workplace. If you have a hierarchy within the space, it can be really hard, particularly for those who are in leadership, who are sometimes meant to be, infallible, it seems. How are we best able to really be supporting ourselves and creating environments that others are able to, live their full lives within that? And so I think that, especially for survivor advocates, that's one of the hardest things to do, because so often, we've been, a lot of our abuse can be under control, right? And so to be able to express emotion, was punished in many families and many communities. And so and also people don't want to open the floodgates sometimes, where it's like, if you can repress things long enough, you can just get through it. And that's often something I still hear as jokes in many settings, where it's like, how are you getting through the day? And it's just by dissociating, by kind of splitting yourself off and pushing things down. And so we don't want that. That's not healthy. It can be okay in the short term. And many of the things that or even those negative side effects, are the trauma responses, or those things that cause interpersonal conflicts, can sometimes be the result of people trying to handle the trauma that they've experienced in their life. They are learned skills. I worked with somebody once who they were amazing and smart and cared so much, but they had this tendency to lie about everything, like the smallest things to big things. And it really kind of came out that, when they were young, they had to lie all the time to protect themselves. It was a protective factor. And even as they got out of the abuse, and even as they started to do such good and amazing work in the community, that is still where they fell back upon. And that's not to excuse it or say that lying is right, but it also really helped us understand more about why things were the way they were. And so the more that we're able to really kind of help people understand how, even how our own brain works, right? I think is just all the beneficial. And so then this final part is that idea, it's all linked, but the rest in self-care, and whatever that may be. For some folks, it is going to sweat or other ceremony. Others, it's dancing and just being able to kind of be in community with people. Others, it's going out to the woods and doing some hard work, right? Me, I just like to sometimes curl up and nap, or those moments where I can play cribbage with my mom. Those are sometimes the most restful moments of self-care that I have. So whatever it is, and I think that self-care has gotten this reputation for being indulgent, or for being something that we can't do within our work, or that it's selfish. And I think that the more that we're able to kind of study that, or to learn about the importance of rest within our movement, within our work. One of the things that it's kind of getting to the next section, but that MIWSAC has done is we have been able to implement a 32-hour work week with Fridays off. And I know that that may not be doable in many programs when it comes to funding or comes to staffing needs. And to be clear, most of us still do more than 32 hours in a week. But to be able to be really thinking about, like, why are we driven to be working, 80, 90 hours in a week sometimes? And how does rest impact our ability to be more present with our families, to take care of our spiritual needs, to take care of our physical needs? When I've worked that many hours, it's not like you can just go for a run or take a walk because things are so busy. And so the ability to even have a little less time and to honor rest and honor those things that we need for ourselves, I think is just incredibly important as well. And so, yeah, and I think that there's so many things that can kind of fall under this, especially for survivor advocates, that we can be doing as individuals, those skills that we're needing to learn. And sometimes it's, advocating for self in terms of, hey, I need to have some training on how conflict management, or I need some training on how to do public speaking, or else I'm going to keep having that be a huge stress for me. And I think that can be really hard, because it's also, once again, admitting a vulnerability. And so I think there's so many different ways that this can really come out. And these are just the three broad buckets that I was able to kind of think about. And so if there's other things that you've seen or thought about, please chat that in. We're really wanting to have this be a good time to just be thinking and try to figure out how can we be doing better for ourselves, and really within our organizations, to create sustainable and effective programming that's going to really have an impact on both the survivors in our community, but also the community as a whole, as we work to prevent sexual violence from happening and respond to it while it still is. So we can go to that next slide. So yeah, as I said, I think that so many of our organizations mean well, but often we end up getting systemized. And especially depending on how your organization is structured. If you're a nonprofit organization that's been around for a long time, if you're new, if you're a huge service area, or if you're in an area that only has, a few thousand people, right? But what often happens is when we get systemized, when we get bigger, or if we're under, like, say, a tribal government, we might not have as much freedom or flexibility in setting our own rules, our own policies that guide us. And sometimes the things that do end up guiding us end up being, I don't know, I think that I've seen so many organizations where it's replicating the harm that has been done. And so, I think of it, I had a boss once who, I deeply, deeply loved and admired, but there would be days where she would yell at us and yell at us. And then the next day we would have flowers appear on our desk. And she would never actually say sorry, but she would give us a gift. And we kept thinking, as an organization that's working against sexual and domestic violence, it feels like you're replicating harm doers' actions by cycling through violence in gifts. And I think, how can we do better than that? And she is still a wonderful and amazing person. I will hold to that. But we have these habits that we have in our lives, right? And how are we as organizations and as people within organizations able to shift and try something new, even within the confines that come with policies that are forced upon us, or things that, our funding dictates that we have to behave in a certain way, or whatever it may be. How are we best able to really embed our individual values and our cultural values within our work to better have a truly trauma-informed environment? And I think that I've seen very few programs who have done this well. And so a lot of the things that'll come on this next slide that we'll go to in a second are really kind of just ideas about what I've seen has worked in small doses. Because I think that if it were a simple process, we would all have done this within our organizations. We don't want to be in organizations that cause harm. We don't want to be in organizations that survivors aren't able to sustain themselves in. And so just trying to be thinking about all those different ways that we can kind of do things differently. And I think at the heart of all of this, and I didn't even actually put it on the slides because I feel that it's just so embedded within, is this idea of how are respect, trust, and open communication important with all of these. And I think that level of trust is probably one of the biggest things. Are we trusting that we are able to be our full selves within the workplace, whatever that may be to the individual? Is it safe to be you? Are you safe to be in that work environment? And so how are we trusting that if our coworker is having a really hard time, how are we trusting that they're going to get the support that they need as well, right? And so I think that at the bare minimum, I really think that organizations really need to take a deep look at the values that guide them. And I hope that people have, values that they refer back to or reference back to that they've created, collectively. And that could be, like 7 teachings of the grandfathers, if you're doing it that way, or they could be things that have really developed from your organization that you are pulling, that you're saying that these are the things that we care about and that guide our work. And that those values align both with the culture as well as the practice. And I say that because so many folks I've seen, they have beautiful charts of values and things that they say that they do, and their website says all the right words. But when it comes down to it, their environments are incredibly toxic. And so we want to make sure that it's not just words. And when you do have these values, that they're not just things that you pull out once a year, but there are those things that guide your day-to-day work. And there's simple ways of doing that. And it's even just, every staff meeting, read out your values or take one and explore it, and think about what does that really mean. I think at one of my last jobs, one of the values was being courageous, actually maybe here as well. And what does that really mean within different spaces? How does humility come out within a work environment? All these sorts of things, and making sure that you have shared language, shared understanding. And also that's such a good thing to be able to reference back to. Like, these are the agreements that we have as a staff, and I'm seeing that this is not being lived out right now. And what can we do collectively to repair that harm? And with that, I think that policies and procedures need to be regularly used and updated with a focus on values and human-centered work. I don't normally like to use a lot of words on slides, but that is one where I just wanted to really kind of drill it in, is that even for folks who are working in child programs where you may have to have like several levels of bureaucracy, or tribal council having to approve any kind of policy change or things like that, that there's still ways of looking at things. And I don't know, to an extent, it's a level of text analysis. Like, so, what's on paper isn't all that we are. It does say something about what guides us and how we are committing to ourselves and to others, what we will be doing. And so if we're looking at our policies, and that can even be something such as, if we talked about the 30-hour work week that MIWSAC has, but also thinking about, hey, do you actually have named in there like self-care money, or not self-care money, self-care time? For some programs, it's, part of what you can use for your sick time, but are you naming it as something that you value, that when things are really stressful, people are able to just, without critique and without issue, take a day off because they just need some time? Is that within your policy? How are your policies around child care? Are you able to bring children within your work environment, which may not always work, especially within direct services, but what does that look like, and how does that align with the values that you are putting out there, as well as what are survivors in your community saying that they need in order to, do good work or to be part of the movement? I think also that thinking about that employee wellness or the organizational wellness, and promoting that individually and collectively. I think that has to be modeled from the top down and appreciated from the bottom up within these hierarchies that I feel that we're often forced into. And so having the directors or whoever it may be, practice good boundaries and practice saying no, which can be so difficult, I think will allow space. If people are seeing so-and-so do it, that frees them up a little bit to do it as well. And really trying to find those ways of exploring, having ceremony together, I think is one of the best ways of connecting with people. It was actually, it was not normally happen, but before I even started MIWSAC, the Friday before I started, I was able to have a ceremony by the water with my coworkers, and to be able to have that connection really instilled both the heart and the purpose of what we're doing, and how culture is that resiliency factor that we need. But even in small ways, I did a site visit to a program, and they offer a little ceremony for the program participants. And when we were there, the staff was like, hey, we should all do this together. And they'd never done it. And so it was something that was being offered, every, couple of weeks for the people in their program, but they'd never partaken, especially not together. And the beauty that can happen when you're in ceremony together is so important. And it doesn't have to be big. It can be those small things that we do. Or even like MIWSAC practices saying 2 things we're thankful for every morning. And it's a very small thing that we do, but it really helps you kind of set your intention for the day. I also think we should, like in survivor welcoming organizations, I do think one of the things we have to think about is also intent versus impact. And kind of what I mean by that is I've seen this both ways, where people have tried incredibly hard to get a point across or whatever it may be, and it doesn't land quite right. And so their intent might have been good, but the impact wasn't. But also I've seen in programs where people are so well-meaning because they're speaking from their heart, they're speaking their truth, and their truth may be raw and coming from a place of survivorship and of the forced resiliency that they were, that they had to learn in order to get by. But the way that it comes off is angry, as brash, as mean and cruel sometimes even. And so even if they were coming from a place of love, the way that it impacted people can cause a lot of harm. And so the intent doesn't negate the impact, no matter how hard. And so having these conversations about naming things that I know what you meant, but this is the way that it felt, and how can we work in the future to kind of shift things and make sure that everyone is feeling safe within the work environment. And with that, I think one of the big things is, supervision and accountability. And I've gotten some backlash over this. I used to be told by somebody who I love very deeply that we're adults, we don't need supervision. And well, to an extent that may be true. We may not need micromanaging, we may not need hand-holding on all tasks, but I think that some issues I've seen within the myriad of workplaces and within the communities I've, been asked to go help in, if there was more ongoing touching base with your supervisor, it could clear up a lot of things. Because I think that sometimes, especially when people are having like a really hard time processing trauma within their life, and those things are starting to kind of come out, one of the ways is that people start to hide. They're not going to meetings, or they're not doing their work quite as well as they should be. And things are kind of starting to slip, and whether or not they're actually lying, or whether or not people are just kind of like not telling full truths in moments. I think that having supervision can kind of both clear that up and help people, hey, this is where I'm really at with things. And also help to offer that support that people may need in different ways. And I've seen so many programs who, I think that because we're just going from crisis to crisis to crisis, think that supervision isn't needed. And because there's gonna be times in life where it's not, right? Times where things are everything going good and you're just having like a little small check-in, whatever it may be. But then I think that if we get in that regular practice, that means that when things aren't going good, that you have that natural relationship and that natural space for bringing things forward. And the same with accountability, which is a rough word for so many people. I've seen so many programs who get really upset even with the terms accountability, how it feels that we're not, like, accountability seems, I don't know, like hierarchical or punitive or something, when we're really meant to just truly be like relative to relative relationship with each other. And to me, it's not accountability in terms of like, you did wrong, but really like, this is our project. This is our thing that we're working on. Like, how can we do better together? And I think that I've seen people who have never experienced accountability and who have never had somebody to even name that what was happening was not okay. And I think that the more that we can have these open and honest conversations, the better. And that includes this ongoing training, which I've already mentioned. And that's both on trauma as well as on all those different things that can help us succeed and grow. And I don't care if you have been in this movement for 6 months or 40 years, I think that all of us can benefit from trainings in different ways, and that we have to have that curiosity and that want to grow and to learn. And I think that survivor welcome organizations both have shared expectations about what that is, as well as the ability to keep doing that. Because I've also seen folks who, because they don't feel that they're adequately trained, they keep feeling that they're struggling, like with every interaction with a survivor, with every interaction with a community partner or whoever it may be. And that if they'd had things better set, that they would succeed a lot more. And really the big part of this is, what is the culture of your organization? Do you have shared expectations? How are people supposed to behave in different spaces, and not in a directive sort of way, but really in that conversation? Because for some people, this is brand new to them, or they come from spaces where, there are different expectations where you have to ask for everything, or you never ask for anything, or whatever it may be. But having shared expectations about what your environment is, I think helps everybody, but especially survivors who've often have had dishonesty, distrust, things that like expectations were not kept up. And so if we behave with integrity as organizations, it'll be all the better. As well as, you know, how are we also within creating avenues for support for survivors on staff, and just really being open and honest about that. I also think one of the things that kind of has bubbled up recently is, what are these agreements that we have on debriefing or disclosure? And so that could be anything from, you know, a presentation that you did in community that was hard, but I'm really thinking of like, hey, for those advocates who, you know, go to court or who go to hospitals with folks, and it can be rough, right? And there's times where you just get back to your office and you just want to vent, you want to talk about things, and you want to like let it all blurt, right? As well as within your own life, you have some things going on and you want it to blurt out, but sometimes people aren't in the space where they're able to take that in. And I know I've sat in spaces where you feel almost like traumatized because somebody's putting everything on you and you're not in the space where you're able to take it. And there are, you know, ways of, you know, if you sit in certain ways and things are able to bounce off you better. But there's times where you just can't hold that. And so I think that like honest, like consent within those moments is incredibly important. We talk about consent within, you know, sexual relationships. So how about having consent within our day-to-day relationships? Like, hey, this is, you know, I just had a really tough hospital call I went on. Can I talk with you about it? And then respecting if somebody says, you know what, I can't hold that right now. And I think that that would be just such a small thing, but really important, because I think we're often expected to just hear trauma after trauma after trauma. And there's some days where we can't, where we need to put up those, as we talked about, healthy boundaries about that. And there's other days where it's like, I can take on all your stuff. I can take it all on. And so really at the end of all this, like we have these ideas, we have these thoughts, but so much of it is unique to the individual, to the community, and it's about balance, right? And I think that remembering that, you know, survivors are the heart of the work that we do. And I want survivors within all of our spaces. And I think survivors need to be in all of our spaces. And how are we, I don't think that our organizations are set up to handle them necessarily. I also, one final kind of thought is, when it comes to these communications, sometimes I think that, you know, I saw this with sexual assault teams a lot, which I did. I worked with a lot of sexual assault response teams in my life. And sometimes I'd have to have conversations with communities about like, is it time to let your sexual assault response team fold? Not that you should never have it, not that you shouldn't be communicating, but is it time to stop trying to force this? And I think that sometimes within our work environments, we need to have those conversations both within ourselves, like, am I the right fit for this position right now? Am I the right person for this organization right now? But also for organizations too, I've seen so many people flame out within organizations where they were great workers and all of a sudden everything just went bad and they left, and then there was negativity on both sides. But I think so much of it could be better if we had these conversations like, you know what, let's talk about this. Is this the right space for you? Or, and so I think those almost like gentle ways of having people really take into consideration whether or not they should be in that work environment. And I hope that doesn't happen, but there are also times where, you know, I've trained so many advocates over the years, and most of the time with an advocacy training, all of a sudden I'd have at least one person be like, I've realized that this isn't the right space for me right now, that I would not be able to do the good enough job. And so I think that having those open and honest communication is what's most important. Next slide. And so, yeah, just a reminder that it's that whole medicine wheel. It's not just about the mental health side of things. It's not just about the physical side. It's about everything that brings us to who we are. And as individuals and as organizations, we need to be paying attention to all of that. Next slide. And yeah, and so another part of this is, so for those folks who, you know, aren't meant to be working with an advocacy program or another related program, what are those options for engagement? I've seen communities where if you aren't able to be an advocate, like even on call for, you know, 5-6 shifts a month, that they have no space for you. And so I would really kind of urge and ask our communities to all be thinking about those different ways. How are we really engaging survivors who may not want to be on staff, but who want to do good work within our community? And so many of those, I mean, there's amazing families and community advocates who are out there just doing their thing, and that's great. And how can we, as these organizations, really help to bolster that? And having that be that reciprocal relationship where it is not just you taking from somebody, but really having it be something where somebody's able to grow and learn, and your organization benefits as well, and thinking about that. And it's not just having somebody be that single voice of survivorship, which I've seen in so many communities. Like we have this one person that we call all the time and they tell their story and they're great. But for one thing, that is an incredibly huge ask of somebody to be the sole voice of survivorship in a community. But also what happened to one person is not necessarily reflective of what happens to other people. And so just really be thinking about those ways of even how you're getting information. I've seen so many people in communities where they'll do, like survivor, surveys. But that's the only way that they'll really communicate directly with survivors is through, the occasional survey, and really thinking about what are those different ways that we can really create inclusive communities. Next slide. And so this was a very quick little overview of something that I would love to explore with more people and love to hear what you've tried in your community. What have you struggled with? What has been successful? And so I do hope that these communications and that this relationship is able to just continue and grow. As part of the Resource Center, I put my email on there. There's also the General Resource Center email. We are available to I want to get into the community and do some listening sessions with folks about this and about the other needs related to communities, or to do site visits and to do some good training within your community. And so please reach out. Those are options there. We're also going to be that page on there with resources within, I think, the next couple of weeks. We're hoping to have more of our resources up on there so that we can have some tangible things that people are going to be able to take and hopefully bring back to their communities to create these changes. And also any of our upcoming events will be posted on this page. And so just a huge miigwech to all of you for listening to me talk for an hour about something that I care a lot about and that I don't have all the answers on, but I really want us as a movement, as relatives, to be able to explore and to do better, because we all need this to happen. We all need our organizations and our work to be healthy and to be able to sustain survivors within our movement. So thank you all.